is Delisa Eddington, and as a nurse practitioner, I have learned a few things about my patients in a few years. I have learned that my patients needed a more comprehensive approach and a personalized and individual approach to their healthcare needs. This drove me to look farther beyond just a nurse practitioner, and I decided to go on and get my Endobiogeny certification, and then I also moved forward into visceral manipulation. With these comprehensive approaches, I was able to kind of treat my patients more individually and have more tools in the toolbox. Then I also noticed another common thing in my patients. A lot of them had some pelvic floor issues that they were embarrassed to talk about, or things that were bothering them on a continual daily basis. So again, back to school I went, and I joined the International Pelvic Pain Society and took some classes through there, and studied and worked with patients and people through the International Pelvic Pain Society. I decided then that I can't be good and perfect at everything, and so I decided to join on with Jared McKee and Sophia Garrett at Custom Rehab so that we can make a comprehensive team to meet the individual healthcare needs of our patients. Some of the things that we really noticed were that people were struggling with a whole list of problems. They were struggling with chronic pelvic pain, lower back pain, muscle pain, sexual dysfunctions, core strengthening or core weakness, prolapse of the pelvic organs, post-pregnancy and delivery care for the perineum and pelvic floor, diastasis rectus abdominis, where they have a hernia through their abdominal wall, bowel dysfunction. We also noticed that they had a lot of tailbone pain, recurrent infections, and maybe some atrophy or some skin disorders in the area, which makes them have more trauma in their everyday life. We decided that with these issues, we needed to look a little further. I really believe that patients shouldn't have to suffer with these problems every single day. These problems can affect their daily life and can affect their future. In order to help them have a better wellness and achieve their health to a better degree, we decided to make this comprehensive pelvic pain clinic. By looking at individual patients, we can look at their individual needs and come up with some solutions and better treatment options. There are options. You do not have to struggle or suffer alone. There's also medication management if we needed to get there. So some of the things that we offer are visceral manipulation, physical therapy. We do Kegel stimulation and Kegel strengthening. We do core strengthening exercises, biofeedback units. We also have trigger point injections, ozone therapy, herbal medications, and like I said, there's also some medications. We're not opposed to either one. We use a very integrative approach. That pelvic floor is key to the rest of your health, including abdominal pain, hip pain, back pain, shoulder pain, and knee pain. So it's important that we address the pelvic floor as an entire piece of our system. It also affects our relationships with those who are closest and our significant others with us. So instead of suffering alone in silence, take a minute. Maybe the solution isn't surgery for you. Maybe the solution is actually simpler than that. We just need to take a comprehensive and a closer look at it. How do you do that? What does that look like? What that looks like is you coming in and visiting with me for a free consultation, and we'll go through your individual problems and your individual needs. Together, we can come up with a plan that will best meet your needs and be successful. Together with Jared and Sophia, we can make the best options for you available to you so that you can get better recovery. So come and click on this link right here, and let's check this out and see if we can't get a better option for you.